My name is Mark McLaren. I was treated 16 years ago for an acoustic neuroma. Back in the early 90s, I detected some degree of hearing loss in my right ear. I went to a doctor and noted that, and they checked the ear and said the ear looked perfectly fine. There was nothing there. I indicated I had no previous problems with it, and they said, well, it's probably just rock music or just one of those things. For several more years, up to 2001, I periodically had medical checkups and continued to note that the right ear hearing was deteriorating some more. And at that point, almost 10 years since the initial time I noted the hearing loss, I was sent for an MRI, and the MRI, as it always does with an acoustic neuroma, came back very clearly indicating I had a approximately 2-centimeter acoustic neuroma at that point. I was extremely fearful. I did not get a lot of explanation at the time as to what exactly it was, what was the prognosis for it. It was very confusing, and I was on my own because I had just been brought back to discuss the results and was not anticipating a conversation of that magnitude. One of the first things, even back in 2001 and certainly today, after my diagnosis, I went to the internet. And the internet can be a place of great information. It can be also a place of great disinformation. In my research, what I understood at that point was that this was a benign tumor. It was not cancerous, but it had impacts because it was located on a cranial nerve. So I started to build some knowledge of what the acoustic neuroma was. I proceeded to neurosurgeon and specialists with the acoustic neuromas, and my information from them did not alleviate my fear in that they were looking at an open surgery option. And the open surgery option was anywhere from 4 to 8 hours, and that I would definitely lose my remaining hearing in the ear, that I had risk of facial palsy, that I had risk of balance issues. So those potential deficits as a result of this were very intimidating to me. Ultimately, what I chose over the open microsurgery was stereotactic radiosurgery. And there are a number of machines that are used around the country and in fact around the world to do it. The two primary radiosurgical machines are a gamma knife and a cyber knife. And I chose the cyber knife. You're not in a surgical suite. You're in a room in an inner part of the hospital. And you lay there for 45 minutes to an hour, depending on your particular treatment plan. When I did it back in 2001, I just laid there and tried to relax. Now they typically let people bring in music, and you get to have your own choice of music playing in the background while the machine does its work. So over 3 days, laid on the table and had the treatment. But my personality, in answer to the question, how confident was I from the day I made a decision, would be not very. I kept analyzing, I kept thinking, I kept going back and forth, and I think that's very true of a lot of folks. But I went through with it and went through the prep for it and had the treatment, and I'm extremely happy with the results I had. I had some transitory after effects of the treatment that are not very uncommon. For about 30 days or so, I had what I called the fuzzies. That's not a medically technical term, but once or twice a day for about 30 seconds, I would have a little bit of a spinning feeling in my head, and so it resolved itself without any intervention. Beyond that, I had no other reactions to it all these years since. 16 years have passed, and I get asked a lot of times, are you happy with your choice? Are you happy with the treatment you made? And my answer is absolutely yes. I've been very fortunate. I came out with the number one goal being to kill the tumor. And after 16 years of going first every 6 months, then every year, then 2, and now 3 years, the tumor is not only not grown, which is the goal of stereotactic radiosurgery in my case, which is not common, it has shrunk. It's a hard thing to go through when you're diagnosed because it's not that common, it's not that well known. And having participated with the support groups of the Acoustic Neuroma Association and chatting with people over 16 years, it's been really interesting to see all the advancements that are happening both in diagnostics as well as treatment.